Imagine sitting in this like brightly lit emergency room, right? Your hand is resting on the examination table.
Never a good place to be.
No, definitely not. And so the doctor walks in, takes one look at your swollen finger, and just gently tries to straighten it out.
Just a really simple, slow movement.
Right, just extending the joint. But the moment they do, you scream in absolute blinding agony.
It's just off the charts pain.
Exactly. And the crazy part, the culprit putting you through this absolute misery, it's not like a table saw accident.
Right.
It's not a crushed hand from slamming it in a car door. It is a tiny, almost invisible little prick from a house cat.
Which is wild to think about.
It is, because when you think about the most dangerous things in your home, you expect the threat to, well, look menacing.
Oh, absolutely.
You expect exposed wiring, or, I don't know, sharp kitchen knives, toxic chemicals, not a fluffy pet.
Right. But, I mean, we are entirely conditioned by evolution to assess danger visually.
Okay, yeah, that makes sense.
So a wide open bleeding gash that sets off all the alarm bells in our brain. It tells us we need immediate action. But a dot of blood the size of a pinhead.
It barely even registers.
Exactly. It's just a blip on our radar.
Which brings us to the mission for today's deep dive.
Yeah.
We're diving into some fascinating excerpts from The Hidden Peril of Cat Bites. And this one is specifically tailored for you, the learner, so thanks for sending this our way.
Yeah, it's a fantastic topic.
Our goal today is to unpack exactly why these microscopic-looking punctures are deceptively dangerous. We'll get into how to recognize the urgent warning signs before you get permanent damage, and the actionable steps you absolutely must take if your feline friend happens to sink their teeth into you.
And, if you're listening to this and thinking, come on, a tiny cat bite, like I've had worse scrapes from a rose bush, your skepticism is completely valid.
Right. It sounds ridiculous at first.
It is incredibly counterintuitive to view a millimeter-wide puncture as a literal medical emergency.
But it is.
It really is. As we strip back the layers of human anatomy today and look at the biological reality of these injuries, you'll see exactly why judging a wound by its surface appearance is, well, a massive mistake.
Yeah, a really costly one.
The mechanics of what happens under the skin in those first few hours following a bite are complex, they're relentless, and honestly, they're terrifying.
Okay, let's unpack this. Because to understand how to treat one of these injuries, we first have to understand the mechanics of the bite itself.
Right, physical mechanism.
Yeah, and the source material draws this really sharp distinction between a dog bite and a cat bite. Like, when I picture a dog bite, I'm picturing this blunt force crush injury.
Messy, lots of tearing.
Exactly. A dog's jaw tears tissue. The resulting wound is, it's wide open and you can visibly see all the damage.
There's no mystery there.
Right. But the sources say a cat bite acts entirely differently. If a dog bite is a blunt hammer, a cat bite seems to act more like a dirty hypodermic needle.
I love that analogy. Let's actually build on that needle idea, because the physical mechanics are nearly identical.
Wait, really? Like a literal needle?
Yes. Think about a cat's teeth, specifically those long canines. They're extremely slender, elongated, and razor sharp.
Oh, yeah, those little fangs?
Exactly. So when a cat bites down on your hand, those teeth don't crush the skin. They just glide right through the tough outer layers of your epidermis with almost zero resistance.
Wow, okay.
They create these deep, incredibly narrow puncture wounds that penetrate straight into the underlying tissues or muscles, or even right down to the structures around your bones.
But the thing is, the tiny hole on the surface, it always stops bleeding in like 2 minutes.
Yeah.
It just closes up.
Which is the exact mechanism that makes it so dangerous.
Wait, the closing up is the problem.
Yes, because human skin is remarkably elastic. The moment that slender tooth is withdrawn, the tissue just snaps back into place.
Oh, wow.
The tiny entry hole at the surface seals itself over almost instantly.
So it's trapping everything inside.
Precisely. Going back to your blunt crush analogy, right? A dog bite bleeds freely, which naturally flushes out debris.
Right, it kind of cleans itself a bit.
And it remains open enough that oxygen can reach the damaged tissue. The cat bite, however, basically closes the door behind it.
That is such a creepy visual.
It creates this microscopic, completely oxygen-deprived tunnel deep inside the intricate structures of your hand.
Okay, so we have this sealed, oxygen-deprived tunnel, basically a literal biological vacuum.
Mm-hmm.
Which raises the obvious question, right?
Mm.
What exactly is trapped down at the bottom of that tunnel?
Well, you basically have an entire microscopic ecosystem injected directly into your deep tissue.
Oh, gross.
Cats naturally harbor a specific profile of bacteria in their mouths, And for the cat, these microbes are just standard, totally harmless flora.
But it's just their normal mouth stuff.
But the moment they're transplanted across that barrier of human skin and deposited into our internal environment, they become highly pathogenic.
So they go from harmless to hostile just by
Wow.
changing locations.
Exactly. And the primary culprit highlighted in all the medical literature is a bacterium known as Pasteurella multocida.
Pasteurella multocida, okay.
Yes, and it's often accompanied by a couple of others, like Staphylococcus aureus and Streptococcus pyogenes.
Those are some heavy hitters. Staph and strep people definitely know those.
Very aggressive bacteria.
But wait, I'm genuinely confused here.
Yeah.
Let's say I'm playing with a cat, right?
Yeah.
I get a scratch or a little bite, just a tiny puncture. I immediately run over to the kitchen sink, grab the antibacterial soap, and I scrub the area for a solid 20 or 30 seconds.
A very normal reaction.
Right. And soap physically destroys bacterial cell walls. I mean, it literally breaks them apart.
It does.
So how are these specific bacteria surviving a direct chemical attack with soap and water?
What's fascinating here is the physics of fluids combined with the geometry of the wound.
Okay, getting into physics now.
Because surface washing is crucial, don't get me wrong, but you are battling capillary action and surface tension.
Meaning the water can't get in.
Exactly, because the puncture tract is so microscopic, and like we said, the skin has already swelled and sealed at the very top.
Right, the door is closed.
So the viscous soap and even the running water literally cannot flow down into that narrow canal. The surface of your hand is completely sterile after you wash it.
But the bacteria aren't on the surface.
Exactly. The Pasteurella has been planted millimeters, sometimes even centimeters, below the skin, completely shielded from your soap.
Wow. So I'm essentially washing the roof of a bunker while the enemy is already safely inside the basement.
That captures the dynamic perfectly.
Wild.
And once those bacteria are isolated down there in that warm, moist, oxygen-free basement, their replication rate just explodes.
Because it's the perfect environment for them.
Pasteurella multocida in particular is notorious for its aggressive expansion in soft tissue. It doesn't need days to establish a foothold.
Right.
It only needs hours.
Which takes us from the theoretical mechanics straight into the real-world consequences. And the source material grounds all of this in a pretty harrowing case study.
It's a tough one to read.
It really is. It follows a 24-year-old woman who experienced this exact scenario. She was bitten on the finger by her cat. She did what most of us would consider the responsible thing.
She washed it.
Yeah, she went to the sink, washed it thoroughly with soap and water, and just went about her day.
And she relied on that visual feedback we discussed earlier. The wound looked clean, the bleeding had stopped, so the threat appeared entirely neutralized.
And the source notes a crucial detail about her thought process here, which I think is so relatable. She had actually been bitten by a cat a few years prior, washed it exactly the same way, and nothing bad happened.
Right, the false sense of security.
Exactly. Her past experience taught her that this was just a non-issue. She assumed she was safe. And it highlights something so vital for you listening. Just because your immune system successfully fought off a tiny inoculation of bacteria 5 years ago does not mean you will win the lottery every single time.
Not at all. The variables change with every single bite.
Like what kind of variables?
Well, the depth of the tooth, the specific location on the hand, the density of the bacteria in the cat's saliva on that particular day.
Oh, so the cat's mouth could just be dirtier that day.
Exactly. So while she was feeling totally secure, the Pasteurella was multiplying exponentially inside that sealed puncture tract.
And the timeline presented in the case study is so aggressive. Within just 24 hours, her finger transformed entirely.
It really did.
Let's look at that 24-hour mark.
Yes.
The source details that her finger became intensely red, visibly swollen, and just incredibly painful.
And the biggest red flag.
Yeah, the detail that stands out most is she could no longer straighten it. This is what led to the emergency room visit and that agonizing moment we talked about at the start, where the doctor tried to pull her finger straight.
And the diagnosis she received in the ER was flexor tenosynovitis.
Flexor tenosynovitis. I mean, that just sounds like a catastrophic structural failure. What is actually happening inside the hand to cause that level of pain?
Oh, so to visualize this, think about how your fingers operate. You actually don't have muscles in your fingers.
Wait, really? No muscles in the fingers at all?
None. The muscles that control them are actually way down in your forearm.
I had no idea.
Yeah. So they pull on these long biological cables called tendons, which run all the way up through your hand and into your fingers to make them bend.
Okay, so it's like a pulley system.
Exactly like a pulley system. And to prevent friction, these tendons are encased in sheaths, basically hollow, closed tubes filled with a slippery synovial fluid.
Okay, I'm following.
When the cat bit her, the tooth bypassed the skin entirely and penetrated directly into that tendon sheath, injecting the pastorella straight into that lubricating fluid.
Oh, man. So the bacteria are now trapped inside a closed tube that runs the entire length of the finger.
Yes, and that is why the pain becomes so unimaginable. As the bacteria consume nutrients and multiply, your immune system freaks out and rushes white blood cells to the area to fight them off.
Right, the body's natural defense.
But the byproduct of this microscopic war is pus and severe inflammation. And because the tendon sheath is a really tough enclosed cylinder, the swelling has literally nowhere to go.
It can't expand.
Exactly. The fluid pressure inside the finger just builds up to extreme levels, stretching those sensitive tissues to their absolute breaking point.
Which perfectly sets up the diagnostic criteria the doctors used when she arrived at the hospital. The source highlights a specific medical checklist known as Knovel's signs.
Yes, very important signs.
So if I walk into an ER with a swollen hand, what is the doctor actually looking for to distinguish a normal scratch from this nightmare scenario? We need to lay out these urgent warning signs so you know exactly what to watch for.
Right, and the examination is actually very systematic.
Okay, what's step one?
The first thing a physician will look for visually is the distribution of the swelling. They're looking for what is clinically termed a sausage digit.
A sausage digit. Graphic but clear.
Yeah, because in a normal scratch, you might have like a little raised bump right at the site of the injury. But with flexor tenosynovitis, because that entire tendon sheath is filling with fluid, the finger swells uniformly from the base at the palm all the way to the tip.
So it completely loses its natural contours.
Exactly, it looks just like a sausage.
Wow. Okay, so the swelling travels up the whole digit. Once they see that uniform swelling, do they look at how the patient is holding the hand?
They do. That brings us to the second sign, which is the resting posture of the finger, known as passive flexion.
Passive flexion, what does that look like?
Well, when you relax your hand completely, just let it hang, your fingers naturally fall into a gentle, slight curve, right?
Yeah, it's just kind of relaxed.
But when that tendon sheath is engorged with pressurized fluid, the finger rests in a rigid, sharply bent, almost hooked position.
Oh, because it's forced into that shape.
Partly, but also the patient's body is unconsciously keeping the tendon as relaxed as possible, because any tension on that cable squeezes the inflamed sheath and causes immense pain.
Okay, here's where it gets really interesting. You have the visual signs, the sausage digit, and the bent posture. What happens when the doctor actually starts examining the hand physically?
The physician will perform a palpation. They'll gently press along the palm side of the affected finger, basically tracing the line of that tendon sheath.
Right.
And the third of Kennevel's signs is exquisite tenderness along that specific tract.
And we're not talking about just mild discomfort here.
Oh, no. Even a really light tap along the underside of the finger will cause a sharp, completely disproportionate spike in pain.
Jeez. And that leads to the final sign, which explains the screaming from our intro scenario.
Yes. The fourth sign is severe pain with passive extension.
Meaning someone else straightening it for you.
Right. If the doctor takes the tip of that bent resting finger and attempts to slowly straighten out, it pulls that tendon taut.
And that squeezes the tube.
Exactly. That action forcefully stretches the critically inflamed, swollen walls of the infected sheath. The pain is described as agonizing.
Unbearable.
So if you or someone you know sustains a puncture wound, and you observe these signs, the uniform swelling, the stuck bent position, the extreme tenderness underneath, and the inability to straighten it without severe pain, you are far past the point of home care.
It's a full-blown emergency.
Absolutely.
But the terrifying reality laid out in the sources is that flexor tenosynovitis isn't even the final stage. Like, it gets worse.
Much worse if you leave it.
The case study notes that if this escalating pressure isn't addressed, the infection can breach the sheath and spread even deeper into the hand. It can lead to potential permanent complications like osteomyelitis or septic arthritis.
Yes.
I just have to pause here. Osteomyelitis is an infection in the bone, right?
That's right.
How does bacteria from a tiny surface prick manage to literally melt solid bone?
Well, if we connect this to the bigger picture of localized anatomy, there is very little buffer tissue in the human hand.
Right, it's pretty skinny.
Everything is incredibly tightly packed together, so once the pressure inside that tendon sheath becomes too great, the sheath can actually rupture.
Oh no.
Yeah, spilling the pastorella and the pus directly against the periosteum, which is the outer layer of the bone. And bone is not a solid, impenetrable rock like people think.
It's not.
No, it's highly vascular, porous living tissue.
So the bacteria just migrate right into the porous structure.
They do. And osteomyelitis bone infection is incredibly destructive because of how the immune system reacts.
Meaning the immune system makes it worse.
In a way, yes. As white blood cells flood the bone marrow to try and kill the bacteria, all that massive inflammation physically chokes off the blood supply inside the bone.
Wow.
Without blood flow, sections of the bone tissue actually begin to die off and become necrotic.
It just rots.
Yes. And at the exact same time, the bacteria are producing enzymes that actively degrade the bone matrix itself.
That is horrifying. And septic arthritis, the other one, operates on a similar principle, just in the joints.
Very similar, but with its own unique set of challenges. A joint capsule is an enclosed space where two bones meet, and it's filled with synovial fluid.
Right.
The critical issue here is that joint cartilage is avascular.
Which means no blood supply.
Exactly. It has no direct blood supply. It relies entirely on the surrounding fluid for its nutrients.
Okay, I see where this is going.
Right. If the bacteria penetrate the joint capsule, they find this nutrient-rich environment where immune cells have a very, very difficult time reaching them.
Because there's no blood flow to carry the immune cells there.
Exactly. So the bacteria rapidly destroy the cartilage, which can permanently fuse the joint.
You just lose the ability to move it entirely.
Forever.
Which really brings the reality of that 24-year-old woman's treatment into sharp focus.
Yeah.
The source outlines that a CT scan was required just to map the internal damage.
They had to see how far it had spread.
Right. And they couldn't just hand her a prescription for antibiotics and send her home.
No, definitely not.
She required emergency surgery. A surgeon had to literally slice her finger open, manually flush the pus and bacteria out of that tendon sheath, and then place her on an aggressive multi-week course of antibiotics just to save the function of her hand.
Because the intervention has to be as aggressive as the infection.
It's a literal race.
It is. Once the bacteria are entrenched deep enough to cause Cannaville signs, mechanical removal of the pressure and the pus is the only way to prevent rapid, permanent structural damage.
Okay, so what does this all mean for you, the listener? How do we take all these terrifying mechanics of tendon sheaths and necrotic bone and turn it into like an empowering, actionable strategy?
Right, what do we actually do about it?
Exactly. We need to lay out the exact steps for treating these bites at home, and more importantly, when to escalate.
Yes.
So first, if a bite happens, the source is super clear on this. Immediate, rigorous washing under running water.
Right. Wash it immediately and make sure it is under a faucet.
No wet wipes.
Right. Do not just wipe it with a damp cloth or try to use a squirt of hand sanitizer. You want a high volume of running water and soap to physically wash away the surface saliva.
But wait, earlier you said the water surface tension prevents it from reaching the deep bacteria.
I did, and that's still true. But you absolutely must eliminate the surface load so nothing else gets pushed into the wound later.
Now that makes total sense. Get rid of the reinforcements.
Exactly.
But the ultimate prevention advice, like the real takeaway from the source material, is step 2. Do not wait for the swelling to start.
This is the most crucial part. Seek early medical evaluation.
Right.
Because this raises an important question about how we view proactive care. The entire goal here is to beat the bacteria to the deep tissue.
To get there first.
Yes. If you visit an urgent care center shortly after the puncture occurs, like before the area turns red, before the pressure builds up, a physician can evaluate the depth of the bite and very often prescribe a prophylactic course of oral antibiotics.
Oh, so you are basically flooding your bloodstream with your own reinforcements to meet the bacteria inside the bunker before they can start multiplying.
That is precisely the mechanism. We mentioned earlier that soap cannot reach the bottom of the wound tract from the outside.
Right, the bunker roof.
Right, but systemic antibiotics, which are absorbed through your stomach and circulated via your vascular system, they can reach those deep tissues from the inside out.
It's Trojan horse, kind of.
Basically. They neutralize the Pasteurella and the staph in the tendon sheaths and the joint spaces before the infection ever gets the chance to organize.
That's brilliant.
Early intervention completely closes the loop. It bypasses the physical barrier of the sealed wound entirely.
So to recap, clean it aggressively with running water, constantly monitor the finger for Cannaville signs, like that uniform sausage swelling or the inability to comfortably straighten it, and prioritize early medical intervention.
It is such a simple playbook.
It really is, but it is the barrier between a minor inconvenience and a literal surgical room.
The margin for error is simply much, much smaller than our human intuition suggests. Our intuition tells us a tiny hole is completely harmless.
But the microbiology tells a completely different story.
A vastly different story.
Well, we really want to thank our listener, the learner, for sending us these sources and joining us on this deep dive into the hidden perils of cat bite.
It's been an incredibly eye-opening topic.
For sure. And our goal today certainly wasn't to turn you against your pets or, induce panic every time a cat walks into the room.
Cats are fantastic companions.
They really are. But our goal was to replace that dangerous reliance on visual intuition with genuine scientific understanding. Knowledge is your absolute best defense against a threat that evolved to be deceptively invisible.
Exactly. And as we wrap up, I want to leave you with one final thought drawn directly from the reality of those permanent complications we explored today.
Okay, let's hear it.
Take a second to just think about the sheer mechanical complexity of your hands. Think about the dozens of joints, the intricate network of biological cables, and the delicate bones that give you the dexterity to type on a keyboard, to cook a meal, or to hold a loved one's hand.
It's a pretty amazing piece of machinery.
It really is. So the next time you are tempted to just slap a Band-Aid on a tiny, harmless-looking puncture wound and go to sleep, ask yourself, is ignoring this really worth permanently losing the ability to ever straighten your finger again?